views and opinions expressed on this show are those of the authors. Any content provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
This is Stanford Medical, okay?
Yeah.
And this was in April 29, 2022, okay? And this is marijuana linked to heart disease, and supplements they're talking about may mitigate the risk. But so basically, I pulled this article because I think it was pretty interesting. And the study, so here it is. People who use marijuana have an increased risk of heart disease and heart attack, according to a large study led by the researchers at Stanford Medicine. You guys could go look at this. It's all, you could just Google it. It's all over. Tons and tons of papers. The study also showed that the psychoactive component of the drug, known as THC, causes inflammation in the endothelial cells that line the interior of blood vessels, as well as arteriosclerosis in laboratory mice. The inflammation, arteriosclerosis, that's blocking the arteries, by the way. Arteriosclerosis can be blocked by molecule. This is, more stages. I'm just going to go here a little bit. But basically...
What does tamp down nausea mean?
Well, when you have...
Tamp down?
So when you have nausea for, like, you're taking... Say you're having chemotherapy.
Is that causing it?
No, it reduces it. It lowers it down.
Okay.
So people use that for cancer. In the meantime, smoking marijuana could cause cancer.
Are you sure, Mike? I don't know. We got to check with Murphy.
So the same carcinogens, you could look this up, the same carcinogens that are in marijuana are in cigarettes. Marijuana has a significantly adverse effect on the cardiovascular system, says instructor of medicine Mark Chaney, MD, PhD. As more states legalize marijuana use, I expect we will begin to see a rise in heart attacks and strokes in the coming years. Our studies of human cells and mice clearly outline how THC exposure initiates a damaging molecule cascade in the blood vessels. And it's not a benign drug. It's not a benign drug. Here's the thing, THC and inflammation. The researchers analyzed the genetic and medical data of about 500,000 people. The researchers found that frequent marijuana smokers who also more likely than non-smokers to have their first heart attack before the age of 50. I know 3 people that smoke heavy marijuana and had big-time heart attacks. They got stents, and 6 months later had another heart attack because they kept on smoking pot. Now, the unusual medical event called a premature heart attack that increases a person's lifelong risk of subsequent heart attack, heart failure, and life-threatening arrhythmias can cause sudden death. Inflammation of blood vessels is a primary hallmark of arteriosclerosis. Researchers found that the level of inflammatory molecules in the blood of volunteers who smoke marijuana cigarette increased significantly over the subsequent 3 hours. They further showed that THC promotes inflammation, hallmarks arteriosclerosis in human endothelial cells. Okay, bottom line is, I don't want to bore you with this, but this is interesting because THC binds to receptor CB1, and you wonder if a lot of these people who died in this country of corona were heavy marijuana smokers. I would like to see that study. That'd be a great study because, these young people who died.
That would be great if you're allowed to have studies about that stuff.
Well, that's a good point, too. Okay, so here it is. But frequent marijuana use causes inappropriate activation of CBI, which can cause inflammation and arteriosclerosis and is associated with obesity, cancer, and diabetes.